Welcome to Between the Lines. We have a replay of one of our favorite shows ever about a year and a half ago, year and 5 months ago. You already know it. Kate's back. Okay, so the free medical clinic is doing great things. Everybody in town knows it. And Kate Hull, the nursing director, I guess we'll say, and the founder, president, Billy, is doing great work. And I've been following them, helping, doing what I can during the year with my limited time. But we have no nonprofit in this city that's more valuable or more important than free medical clinic. And we have a lot of people. The vast number of things they do is incredible. Kate has her own truck, a mobile thing. She runs around all these counties and helps people and tests them. And then you got Billy trying to keep the whole business afloat. And what's the budget now annually?
Oh, $1.8 million a year.
It takes a lot of money. I bought a tea today at Outback, and the business made $3.79. I called the manager over, and I never do that. But $3.79. So my point is, the mill aid doesn't go where it used to go.
That's
right?
true.
All right. Well, welcome. We got 3 segments. Segment 1 and 3 is here. We've got 3 outstanding people going to join us in the middle of the show and talk about community outreach and how to get involved. All right, Billy, you're getting ready to go into a new area. Now, just give me a 3-minute. Well, Kate, go first. Give me a 2-minute summary of the services you provide, generalized.
Well, as you know, our mission is to provide no-charge primary care. We
That's
also
correct.
Preventive and specialty to the low-income and uninsured residents of Anderson, Morgan, and Roane County, and that is the working poor.
3-county area, that's right.
That's the working poor. These are people that are make too much money to get TN care, so they're turned down, but not enough money to get medical care or health insurance. So we help with that gap. And that gap, there's over 14,000 people, residents of our neighbors, Anderson, Morgan, and Roane County, that woke up this morning with the fear of thinking, what if I get sick or hurt? And I have to choose between putting food on the table or going to the doctor. Free medical clinic takes away that fear by saying you don't have to choose.
My understanding is if you got Medicare, you don't qualify.
That's right.
What if you have Medicaid? What if you're poor? You got Medicaid.
No, if you've got Medicaid, basically our Medicaid apparatus for Tennessee is TN care. So these are people that have applied for TN care, but they get denied because they make too much money. And so these are the people we're helping are the people that's in Walmart's, people that's in Burger King, McDonald's,
the minimum
landscaping.
Rate.
It's the working poor. It's not the people sitting on their couch wanting another handout. It's people who are working hard but just can't make it. We've all been there. We've all had times where we need the help of others, and that's why we exist. And Kate, share with us a little bit about what we provide on the medical end for them for no charge for any of this.
That's right. So this is all no charge. Our mission is to provide primary care to the patients that come to us, but we broaden that to include specialty care, and we do that with a whole core of both staff providers and volunteer providers. So we've got really generous individuals in the communities that we serve that once they might retire from their practices, in their heart, they want to continue to serve. So they come and they work for us. They do primary care. They do specialty care.
Like Dr. Luckman.
Like Dr. Luckman,
exactly.
like Dr. Michael, Dr. Lawson, Dr. Barry, Dr. Reed. These are all incredible volunteers. We also have nurse volunteers and we have admin volunteers. And it takes all of us to provide primary care, specialty care, and other programs to our patients. And some of those programs include a hepatitis C program where we can take someone from diagnoses to treatment to cure. We've got a women's health program. We do optometry. We just branch out and provide our patients everything that they need so that they can get what they need within our clinics.
Anything you can get at your clinic. And I love Summit. Summit does great work. Covenant does great work. They're one of our partners. I have a primary care clinic with Covenant, and anything I can get at my clinic, people can get at our clinic. But there's no charge.
Including medications, including having labs taken, if they need an EKG or a pulmonary function test, if they need help with sleep apnea. We do everything that we can to provide these services for patients. So once they come in our doors, we do everything possible to make certain that they receive the best of care, the same type of care that anyone with insurance has, and maybe even better.
Yeah, that's a big deal because if you're looking at 2023, we helped over 12,000 had over 12,000 patient appointments worth over $7.8 million. So think about that. If 12,000 of our neighbors did not receive those cares as far as their patient appointment numbers go, and that $7.8 million of care disappeared from our counties, where would they go?
I had somebody come up to me, and saw me down there one day, and came up to me, and I can't remember who it is, but he said, what was it? He said, if they hadn't have found my cancer, I would have died. I had nowhere else to go, et cetera, et cetera. And they found it and they helped me and got me treatment. So I can't say enough good about it.
We had a lady, really quick, share Kate, about a lady who got diagnosed with cancer, but also what we were able to do for her.
So with our new women's health program, we've started bringing all of our women in for annual comprehensive exams, and we also can provide free mammograms for them, which is, one of the recommendations for all women is to get routine mammograms. And this woman got a mammogram. It came back that they wanted further studies. We were able to provide that for her. She needed a biopsy. And at the end of all of this, she was diagnosed with cancer. And you can only imagine for someone who gets diagnosed with cancer who doesn't have insurance, you've got fear upon fear. And so we were able to guide her through the entire program with the state. This is the state program that
How old was she, may I ask?
She was in her 40s.
Okay.
Right.
Pretty young.
Well, but that's a typical age.
Yeah.
And so we were able to get her through the state signed up for TennCare, which now she's under treatment for the cancer. And as soon as that treatment is finished, she can come back to us as a patient.
Wow. That's incredible. That's a good story. Billy, tell us about the times and when you're open, when you're closed.
Sure.
They can't run down there at 4 o'clock on Sunday, so when are you open?
Well, just like most clinics, we have operating hours, and it's Monday through Thursday from 8 a.m. to 4 p.m. We have locations at Oak Ridge, which is right behind Zaxby's, Rockwood now instead of Harriman. It's almost right at the end of downtown. And then we have a mobile unit, which is fantastic right now. What an incredible tool. Going into Petras, Bryceville, Rocky Top, Scarborough community. And so we're making sure that gets around to communities with it. Transportation is a big issue for our patients because not only do they have medical needs, they have social needs. These are the same people that may need food. You're talking about getting 100 boxes of cereal the other day for families. Our families are being crushed right now with the economy, but these are families that need food, they need clothing, and they need the other things. And so we're making sure that transportation isn't an issue. Because some of them would think, I'd like to go to the doctor and it's free care. I just can't get there. But our mobile unit goes to where people live to make sure it gets closer for them.
Tell me, either one of you, tell me about, you wake up Monday morning, and what does the mobile unit do by next Monday morning? You know what I'm saying?
Yeah.
Where do you go? What do you do?
So we've got very specific locations that we have the mobile unit in, and we might rotate them, but we spend enough time in that location
people need to depend on it.
Exactly.
Yeah,
so we on Mondays we're in Clinton, and I'll have our community health workers talk more about that. On Tuesdays, we're now going to have a rotating schedule, hopefully at Rocky Top Community Center, some of the locations in Harriman and Morgan County. On Wednesdays, we're in Petras, and on Thursdays, we're in the Scarborough area, and we are really increasing our patient load because now patients can anticipate that the mobile units is going to be there. They get the services, every service that they could get in our clinics, they can get on the mobile unit.
And I'm just thinking in terms of stuff I've worked with, as your patient base grows and gets bigger, doesn't the cost get greater? I mean, don't you have more?
Well, it's interesting. It's every business has a metric they use.
That's right.
And with our metric, the more patients we help, the more we go into the hole. Because it costs us $125 per patient encounter. The state, we're part of a state program called the Safety Net that gives us on average $68 a patient encounter. So that we're shortfall at about $75 per patient encounter. So the more people we help, the more money.
Multiply that times 12,000, you figure it out real quick, don't you?
Really quick. And so the way we have to accommodate it is through not only our concrete locations like Rockwood and Oak Ridge and Bryceville, but also the mobile unit and cushion in some of those gaps, but also the remote area medical events that we host. Medical events, Kate gave you basically the Monday through Thursday of the mobile unit, but we do a lot of events on the weekend to make sure that we bring care to people. And remote area medical's coming up that we're hosting at Roane State Community College in Harriman. We're so appreciative of Dr. Whaley and his staff and Roane State for allowing us to have that.
Another Cofield guy.
Another Cofield guy.
See,
that's right.
I explained real quick. Kate and I grew up in the same neighborhood. These guys are all from Cofield, so that's why we tease them kid a lot. But go ahead.
But doing a combination of events, a combination of regular operations, those work together to try to address the capacity. But I want you to think about this. Okay. Look at the numbers. 14,000 residents qualify for the free medical clinic. If they were to go to the doctor on average 3 times a year, that's 45,000 patient encounters. That's the number that we have been mandated to try to reach. So
Okay.
when we look at 3-year plans, 5-year plans, 10-year plans, how can we make sure we help 45,000 patient
You
appointments?
see, here's where it goes, folks. Every time they see a patient or add a patient, they're getting $68 to treat that patient, and they're going another
75.
$75 down that they've got to raise somewhere.
Yep.
So it's important, but it's a mission. You got to do it.
That's right.
So, tell me about patient numbers in Anderson, Roane, and Morgan. Morgan will be the smallest, probably.
Yeah, our patient count of the 12,000 are probably 60%, 50 to 60% Anderson County,
Doesn't matter.
35% or so
be
Roane
right.
County, and
10
the
to
remaining
15.
Morgan County. And plus, we don't have a physical building in Morgan County yet, and so we're working toward that. But Morgan County has a lot of TennCare residents, where the other counties, we've noticed that when counties have a lot of great places to work, even part-time, that they need us more than they would in a county that is underserved and at risk, which Morgan County would be, because a lot of them are on TennCare, Medicare, and things like that. And so, so that's basically how we're thinking through the capacity standpoint of that 12,000. But when you look at the 14,000 I mentioned earlier, 6,000 require services in Anderson County, about 5,000 in Roane County, and about 4,000 in Morgan County.
Wow. What are the types of things that these people could have got service and did, and I get that group, you were convenient for them, but what kind of things are you doing that basically they have no chance of getting in these rural areas or these urban areas? What kind of services, in other words? You gave a good one there, but I mean, in other words, there's a lot of people that get free mammograms if you pay attention.
Right.
Yeah.
But there's some things that you do that maybe they wouldn't get.
Hepatitis C treatment
Is
is
it
a
that
big
big?
one.
Is there a lot of hepatitis C?
I think people would be shocked at how many people will test positive for exposure to
Carriers.
Hep C. Yeah, and so as we identify these patients and we're able to confirm that diagnosis, we are then able to get them directly into treatment. And this treatment for one hepatitis C patient, it can cost, I mean, it has a value of $90,000, and the cost to us is $250.
Wow.
So for every $250 that we spend to treat hepatitis C, the patient receives a $90,000 return on that investment. And it's a cure.
My question is, why
100%
does it cost $90,000 everywhere else when you're $250?
The medication is what is so expensive, and if you don't have insurance, you're forced to pay out-of-pocket prices. We're able to get these because of the income level of our patients. We're able to get this medication directly through the pharmaceutical companies. And so it's just another example of how we can bring a total program to help resolve some of these social issues, community health issues. But hepatitis C is pretty prevalent.
It really does come down to community health, and I know that's what we're going to be speaking about next. But the community health is this. The work that we do with the uninsured impacts from a positive or negative standpoint to those who are insured. Mm-hmm. Because if we have a lot of community members who have Hep C, then the potential of even those that have insurance getting Hep C from their family members or their friends is higher. So the work we do from a community health standpoint lifts the health of the entire community.
Well, I think everybody understands that a lot of these diseases, like hepatitis, can be transmitted sexually or with needles. Is there other ways you catch Hep C?
Oh, absolutely. It's a blood-borne virus. And so it can be transmitted something as innocent as sharing a toothbrush or
Yeah.
taking care of an elderly grandfather or parent who had Hep C and no one knew it, and you're doing day-to-day activities to take care of them.
How many carriers
blood
are there?
transfusions, also
Silent
another way.
carriers, silent, was that a good word?
So it's a virus, and if you're exposed to the virus, the body is either going to fight the virus off, like any virus, or it's going to stay within the body. If it stays, then it has the chance of just people...
You may never get sick, but it could be community.
Exactly. But if you do get sick, it's
Well, and that's the danger in community health if it's not addressed, because on average, there's over 30% of our residents that's walking around with diabetes and doesn't know it.
Yeah.
Over 30% has high blood pressure and doesn't know it. But can you imagine how many people may have Hep C and doesn't know it?
Yeah.
And so they're not only putting themselves at risk, but they're putting their loved ones at risk. So the fear of when you find out, oh my gosh, I've got Hep C. You know, when we were growing up, there was no cure to Hep C.
That's correct.
You had Hep C, you basically had a death sentence you were going to live with it the rest of your lives. But now there is a cure. And so the key thing for the free medical clinic is this: how can we increase access to care for people that can't afford it? And then how can we give a comprehensive approach to their health plan to help our communities?
How do we test somebody to see if they have a hep C?
Great question.
It's a rapid blood test, very simple. We offer it to every single patient. We encourage everyone over the age of 21 to get tested at least one time in their life. Most people don't have access to the testing. They're not offered the testing through their primary care providers, but we automatically do, and we get that. We qualify for that through a state program. We get every single staff member to be certified to be able to do the testing, to do the education. So it could be a non-medical person that's going in and doing that rapid test and providing the education. I just think it's really important that all of us, including our volunteers, understand the course of this disease. This is something we've been passionate about.
We'll pick up more later. We're going to take a break, and then we're going to bring on superstars, 3 superstars who are representing us in the community and helping us and reaching out to different segments of the community. We'll take a break, Chandler.
Daniel Forrester has been trusted by Anderson County families for nearly 2 decades. Daniel has appeared in Anderson County Chancery, Circuit, Sessions, and Juvenile Court thousands of times over the past decade. A Rule 31 mediator, Daniel has been trusted to mediate hundreds of cases across Anderson County. A community leader, Daniel has worked closely with local officials to make Anderson County a better place. A conservative and dedicated husband and father, Daniel's faith has shaped his character and integrity. On March 5th, vote Daniel Forrester for Anderson County Chancellor.
From Oak Ridge, Tennessee, IB3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. IB3 Global Solutions. Mission first.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
At Navarro, we partner with our clients to advance clean energy and deliver effective solutions for complex challenges in the nuclear and environmental fields.
When should you get tested for COVID-19? You have symptoms of COVID-19, such as runny nose, congestion, sore throat, fever, cough, shortness of breath, muscle pain, headache, chills, or loss of taste or smell. Current testing recommendations say everyone should get tested immediately if they have symptoms of COVID-19. If you have symptoms, be sure to follow recommendations about how long to stay home and away from others. For more information, visit our If You Are Sick or Test Positive webpage.
All right, crew, let's get started. Sure.
Don't ignore the law. You must call 811 at least 2 to 3 days before any digging project so you can avoid hitting our essential buried utilities. For digging projects big or small, make the call to 811.
Okay, we're back between the lines. Let's figure out what day it is. February 22nd, Thursday the 22nd, right? I did good, Brad. We have 3. What would you define this classification of workers as? Outreach, community outreach individuals?
We're community health workers.
You actually do health work too?
Yes.
You're not just finding people like, you come here, you come here.
No.
Is that okay? All right, so community health workers. What made you get involved in this? Let's just go right down the line, 2 minutes. What made you get involved in this business?
The reason that I came to the free medical clinic is I grew up in a rural Appalachian town in Kentucky.
What's the name of it?
Macquarie County, Whitley City.
Oh, I know Whitley. Go ahead.
And I grew up there, and I
That's right.
seen a huge level of health disparities from the time that I was growing up, and people that had no access to health care. And when the opportunity came for me to join the free medical clinic, and I found out what their mission was, I knew that that was the path that God had chosen for me to go down with my nursing.
Fair enough. So you have a nursing background?
Yes.
Everybody has a nursing background? Everybody in the, no, not everybody. Okay, we'll keep going one by one. So you have a nursing background. Then you got your nursing degree from?
Somerset Community College
I
in
know.
Somerset, Kentucky.
That's great. You're right over the border. We used to have to drive in the 60s up to my grandparents in Illinois. We go to Danville, Somerset. So I know all those areas.
Oh, yeah.
Good country, good people. All right, sir. Tell me about yourself.
Name's Walter Hernandez Jr. Reason why I came to work with pre-medical and helping the community is I come from a pastoral background. As a pastor, I've always seen the Hispanic community. I worked with the community. I've always helped with the Hispanic community. And for me, coming from having a father who got injured and my mother and myself struggling to put food on the table, I understand how to, deal with medical and being able to find out what exactly to do. And so for me personally, working as a pastor, working with the community, having people there asking for dental, for vision, for medical care, for me, the second that, free medical was being able to help undocumented workers and getting more involved with undocumented workers. And for me, it grew my passion. It right away said, if I can help my people in any way I possibly can, and I mean all people, that right away called my heart right to it.
I'm speaking, just before we start, I'm speaking just for myself, but I think they have to realize that if I'm sitting in the middle of a town and this half is Irish and this half is English, I relate to this half. I know more about this half. So sometimes those kind of connections with specific communities are beneficial. Doesn't have to be everybody all the time. Sometimes you've got a calling to a certain community. I think that's because you communicate good in those communities. I think I'm just talking for me, nobody else, et cetera, et cetera. Where did you grow up?
I actually grew up in California. Okay. And from California, I ended up moving to West Virginia, came to Tennessee, but
that's good.
One of the benefits of working with the Hispanic community is I speak Spanish.
That makes sense,
that'd be kind of awkward being able to help the community.
Yeah. That's good though. That's right. I mean, and that develops a trust factor. Although a lot of Americans speak Spanish. I mean, it's just still a lot of people. But having that, being able to do it, I get it. I got it. How many? 10 years ago, there were 8,600 Hispanic residents in Anderson County. How many are there now?
At the current moment, the number has actually grown to a 4%. So from what that was originally, now there's about 4% more increase in Anderson County.
So 1.04. All right, young lady.
All right, my name is Christine Marshall.
Okay.
And I came to FMC because of my friend Keisha. She's like, oh, you'll be great at this because you got a heart. And
look at Keisha doing recruiting. That's great.
She recruits. So when Keisha speaks, you listen. So it has to be good when she speaks. But I came because that's what I was born to do. I was born to serve my people, and I mean everybody. Yeah. I do focus on the African American communities. I find that I relate more with them because I'm an African American.
Sure.
And then of course I know the need because I was the one that was in need at one time. So the free medical clinic does wonderful things, and I want to be a part of that.
Yeah. It's funny because probably the two communities I'm closest to are the African, you would know, it's the African American community, and my hero growing up was Chavez. So, I was in the 70s, and I met him one time, a couple times on some on farm worker issues, so I know a lot about that community as well and the needs and struggles, speaking of California. Okay. Tell me what y'all do on a week-to-week basis. Just cover each other, act like you're sitting in a coffee shop. You can interrupt each other, whatever you want to say. But you seem to be the gang leader here, so I'm going to let you go first.
All righty then. Every day is different for each and every one of us because we focus on different areas. For me, for instance, I work out of our Roane County Clinic in Rockwood on Mondays, and I focus my time there on Mondays doing patient care inside the clinic. On Tuesdays, I come to Oak Ridge and I work with our Hep C doctor with the Hep C program because the largest amount of our Hep C patients, unfortunately, are coming out of Roane County. So I work there and focus on that with him on those days. That way the continuity of care for those patients can be contained and the same all the time. And then on Wednesdays, I'm on our mobile unit in Petros, serving at the Morgan County area. And on Thursdays, that's my community health day. That's the days that I'm getting out and I'm talking to our partners. I'm talking to other businesses about becoming partners. I'm seeing where there is a need for help. I'm setting up maybe a Hep C testing clinic at a certain partner, or there may just be a need for me to be somewhere because someone needs help.
Sure.
You know, in Roane County, we have the warming center for the homeless that opens up during the cold winter months, and there are times that I do go there because if it maintains below
Define warming center. I call it a homeless shelter, right? Same
right.
thing. Okay.
Well, it is, but it isn't, because the warming center is only able to open if the temperature is going to be below 32 degrees.
Makes sense.
And allow people in to sleep for the night to be able to stay warm. And then they are allowed to stay open through that next morning until the temperature reaches above 32 degrees.
And they gotta go.
And then they have to go. So it's not like your typical homeless shelter that's open every day, every night. It's only open during the cold winter months. So sometimes I go there because there's people that are in need of care and they can't get down to our clinic. So I'll go do what I can for them and then try to make arrangements that they can get the resources they need, or they can be able to get to the clinic for a follow-up appointment with one of our providers.
I see the targeting market. Now, we have a concentrated, not really, because I've done the math on it, but still there's some concentration of African Americans in certain communities in the region. And there are certain, if you've never been to Whitley County, have you all ever been, you two? No. Morgan and Roane is perfect for Whitley County because that's a rural area, but good people, hardworking people. The Hispanic community is spread all over. I mean, you don't have any concentration. It's here, and everything. Is it harder for you to relate? I mean, do they come to you and that's how you are able to work, or can you look for needs? You know what I'm trying to say.
Yeah, so what we like to do is try to work with local businesses, Hispanic businesses. So I try to break it up in regions. For example, Monday, try to hit the Clinton, Andersonville, Rocky Top area. And then, Tuesday kind of spread out a little bit farther towards, Upper Knoxville, Lenoir City, and Wednesday, Rockwood, up in Rockwood, Harriman.
Sure.
Thursday, move towards Oak Ridge.
Okay.
I mean,
got you.
population-wise, we're more spread, but I try to work more with trying to get with local Hispanic businesses, because I mean, obviously Hispanics, we love our beans, rice, and tortillas.
Sure.
So we're definitely going to go there.
Yeah.
That's the
Caucasians
number one
are big
place
on
we're
that
going to
too,
go.
yeah.
So that's I try to break it down to different sections, and then obviously when they start spreading the word of saying, hey, there's a place that's giving us free medical services. Mm-hmm. And that just starts spreading as a wildfire. And then when they're going into those restaurants and visiting those businesses, they're looking at our, information, how RAM is coming, and, that we're going to have dental and vision. And that's one thing that they're looking for right away. So it just opens the doors for them to be able to see that.
You have to be an adult, though, right?
Yes.
Yes,
to
sir.
work on this. Okay, I remember that from the last show.
One day I was off. It was a Wednesday. Junior was in Roane County. I went to eat Mexican for lunch, and I started trying to talk to the employees there. They didn't want to talk to me. They didn't want to talk to me at all. So, because I was asking, do you all have health care? Do you need health care? They didn't want to give me any information. So I called him. I'm like, can you come down here?
Yeah, sure.
And he was able to talk with them and get several of their employees signed up for services.
Okay. I want to talk about the Scarborough community, and I want to, because I have a lot of history there. Me and a couple of buddies of mine, we were the first to ever really go over there and play ball in the 60s and 70s when integration was first starting to happen, and we developed families, relationships all over the place. Scarborough was 70-80% of the African American community. Actually, a man on Outer Drive below me was the first African American to move out into our part of the community. But now, 2/3 of the African Americans, based on my voting data, 2/3 of African Americans in Anderson County live outside of that concentrated area. So it's not as easy as it used to be. But Scarborough's full of senior citizens.
Yes.
Full of senior citizens. And they've been there for 30, 40 years. One of the most beautiful places in Anderson County, too. Just gorgeous with the sunset and hills. Tell me what's going on. How do you reach them? Are you getting good responses?
Well, actually, I'm brand new, so I've been there over a little month.
That's
a
okay.
little over a month.
That's okay.
But I went. They had the Scarborough 85. They did a storytelling on last Tuesday, and I went. I met some of the actual members that were still alive, and I spoke with them. And they talk like it's like today. They so vivid with what they remember, and they tell you how it was and all the shops and how proud they are, And
excuse the slang, but the block was a great place 40 years, 50 years ago. There were clubs, there were businesses. One of my arguments about integration has always been the big part of integration swallows up the small part, and the culture gets lost sometimes. And there was just so much culture out there in the 60s and 70s. I can't even describe it.
Yeah,
But
I was new, and they
Sure.
gave me so much information, and where I could go, and it's like, please, they invited me to different events that's
Yeah.
coming up.
Good.
I plan on going just to learn more, but they're still there, and one little guy, he's so feisty, and he was just like, I just love my neighborhood, I love my community.
Yeah,
So
and that's a good thing to build around. We're working on trying to get some funding, but Rose and all of them, and of course Larry Gibson I've known for years, and some of the other 85 members. But part of the problem is they're dying. I mean, four of them. I mean, we're talking about people in their 80s, and they're dying at 4 or 5, and we're trying to get some stuff done there. I don't know. A lot of the African American community was well employed with the government, so I don't know. I'm sure most of them have Medicare and stuff, but I don't know. I don't get a feel without kids and family, but just a great successful area. That's a good idea. Just stay involved and get it out there. But if you don't live in Scarborough and you're living in Woodland or you're living in some other part of the city, you're going to have to get some kind of communications out to the African American community that service is available in Scarborough or this service is available wherever. Because I'm thinking through I'm going across. Glenwood has a lot of African Americans. Other places do, and some don't as much. But it's interesting. I think it's a community that, of course, is dear to me. But I think that there's spread out. But I think you can find them and get them that need those services. We need those services, and that's great. Now I want to ask a question about what's the biggest challenge for you guys. Whitley County, you get to go first.
It's earning trust. I go into these rural communities, and these are people that haven't had health care in a long time because they couldn't afford it, and they don't necessarily want to trust me. Who am I coming in there telling them that I can help you for free? They don't believe anything's free. So earning their trust and getting
right about that.
Yeah, and getting them away from their old home remedies that they've been using for years, that's challenging. But building that trust, once they see that they can trust me, and that what I'm saying is true, and they're not going to get a bill from me providing care for them or helping them get care, it becomes a little bit easier. Then they tell their neighbors, and then I'll talk
Similar
with the
everywhere.
neighbors.
I mean, that's all. That's pretty much what's going on. In the Hispanic community, let me ask a question about that. Let's talk about undocumented individuals. They can't get medical care, or they can get medical care without you. Don't exist. If I'm an undocumented in Virginia or California, what am I not allowed, and what am I allowed to get?
So here, if we go with Tennessee, at the current moment, they used to be able to go to the health department, but recently things have changed and they have not been able to go to the health department. So they know that they've been trying to find a place to be able to go and get medical care. So that for us, being able to be...
So basically you're saying that our legislature has made it difficult for them to go to whatever. That's me talking. Ain't nobody else talking. I understand. So they cannot go any longer to the health department and get help. They have to go somewhere else.
So at that moment, we have to choose. Do we provide food on our tables? Because we're very family oriented, or we get medical care. And for us, that's already a given. We take care of the family. You take care of your family.
Yeah.
And so for us, it's about being able to work and not really worry about our health unless we really, really have to go to the hospital. If not, we won't. So, being able to find a place to go to, that automatically takes that fear away from them and gives them the opportunity to be able to choose.
That's good. That is good. And that's what you've got to do. It's just really marketing. You got to get your name out there and do what's necessary to do. And I was talking to Kate earlier about I go to the food banks to deliver food and do things. The people in the lines before it even opens, 35 degrees, and they're laying are 75, 80, 72. I've never seen that. In all the years I've helped, I've never seen that. It was always drug dysfunction, and I see little kids this big in line. But seniors are struggling. And that should be a big clientele for you. Are seniors a big part of what you do?
It is, up until the point that they are eligible for Medicare. Once they're eligible for Medicare, they will transition into Medicare and a Medicare provider. But up until that point, they
I didn't think about that. So basically, you could be 62 or 61, not qualify, and you got to go to the free medical clinic until you're old enough to get subscribed. I got it now. So we are helping Medicare patients that have not become eligible for their Medicare yet. I got it. Okay, that's good. Whitley, that's good. Okay. I know Whitley County, so I can joke about that. Okay. How long have you been in this program? How long has this program been around?
Our community health program,
The jobs that you all are doing for Kate and Bill and all. When did you start?
I started January 2nd of 2023.
And I think you were first. I'm guessing at that. You were first.
Yes, sir.
You let her talk too much, man.
June 2022.
All right. So that was the beginning of the program. They felt that there was an immediate need for Hispanic community outreach, especially with the laws changed. Pretty good. That's good. I like that.
It just took them a little longer to
To
find
get
me.
that, that's right. You were hiding in the country. That's what happened. Then we got it done.
And then
All
I
right.
brought her.
You brought her.
So let me explain a scenario for you
Yeah,
real quick.
explain anything. Yeah. Good.
Hola, bienvenidos a la clínica gratuita. Nosotros tenemos servicios médicos, podemos ayudarte con salud de mujeres, te podemos ayudar con la hepatitis C. Now, with all that, did you understand what I just said?
Not the content. I understood basically what you were saying about coming to America, women, and I got some of it, but I didn't
So
get those.
what I
I wouldn't
mentioned-
want to translate it.
What I mentioned was, welcome to the free medical clinic. We have medical services, we have Hep C, we have women's health.
Yeah, I saw that. Heard that.
Being able to launch and having Hispanic volunteers, Hispanic workers to be able to break that barrier between not understanding what they're telling you and be able to translate and tell them, hey, this is what you're needing. Hey, I'm having trouble with my knee or my back or my throat or whatever, and they'd be able to express themselves. These are the things that are going wrong with me. And then having somebody be able to turn around, translate it, and say,
Yeah.
this is what's wrong.
Do you have any Hispanic volunteers?
We do. We have quite
Good.
a few now.
Because you can't be everywhere.
That's very true.
You know what I'm saying? That's good, though. And I think they probably, yeah, I'm just thinking, takes a while for me. I got, but, all right, so what do you think needs to be done? I want you, forget they're here. I want you to say, if we're really going to make this work in the next 2 or 3 years, we need this. Go ahead, Whitley, you're on the spot. What do you got?
In the next 2 or 3 years, to expand what we are already doing and be able to reach all 14,000 people across our service area, we need more donations. Because for every $1 that we raise or have donated, we're able to turn around and turn that into $5 worth of medical care for someone. So,
But if I gave you $5 million, which I do not have, no idea. Don't tell Kate that. Don't tell
you
Kate I
done
got
deep
$5
in
million.
now.
But
Billy be
if I
expecting
make a
that.
line, if I make a donation, okay, somebody gives you seriously a large sum of money, you don't have the patience yet to apply that money to. You'd have to expand the services you have with your existing patient base. Point being, you've treated 12,000 people, but you can treat more. And I know there's some redundancies in that 12,000, some repeat customers.
Mm-hmm.
But still, the question comes down to, you're exactly right. And that's what Kate and I were talking about. Do you need donations in order to expand what you're doing, go more places, hire more people? What do you think? What do we need more? Can't say money. She already used that answer. Well, you can use it, but you know what I mean.
Volunteers. People
I think
desire
that's a good-
to
yeah.
help.
And I think they're out there. I think you got to find them. I'm around them. You got to find them. And it's hard. Hispanic community, you're going to have to find them.
Yes, sir.
I don't think they're going to find them. They might, but but there's some fluent Spanish-speaking people in all cultures. But you still need, but they don't have the connection to the community you do in that sense, et cetera, et cetera. All right. What about you? Tell me, what would you do? You've been there a month, and so you're looking around saying, I don't know if I'd have done that. I might do that. Where are we at? Where do we need to change to get to the African-American community?
We need to just get out there, and if we have to, knock on doors. Hey, we're here. We just got to let them know.
Yeah.
We just got to let them know we're here so they know where to come to get the free medical attention that they need.
Okay, yeah, that's it. So do you have a target list? Do you know where the African Americans are in Anderson County?
I'm working on my list, and I got a feeling you're going to help me and tell me some places today.
I don't know. I got to write a check to Kate, so I may be really busy at that point at that show, et cetera, et cetera. Hey, you guys are great. I'm glad you're doing this. All of you, go ahead, sir. Anytime.
I have
We got plenty
one
of time.
last thing.
Okay.
I know it's going to be hard for us to reach everybody, but if you guys go to our website at fmcor.org or look up our website or even our phone number and call us, we are there at your disposal to help. We might not know who you are, but hopefully with everything that being here, our mobile bus that's running around all over the place will give you the exposure to be able to turn around and say, hey, that's what I need.
I like that. Can we don't have to put it all up. Can we get the number on the screen, Brent, before the end of the show?
For that show.
That's good enough. That's good enough. Because that way you can go back to the box cash, you can go back to the film, and you can look at the number that you may have missed or not written down when you're driving or something. We'll get it on there. And that's what we're going to do with that. Okay. Let's take another break, Chandler. I appreciate you guys. Appreciate everything you're doing, too. All right.
Daniel Forrester has been trusted by Anderson County families for nearly 2 decades. Daniel has appeared in Anderson County Chancery, Circuit, Sessions, and Juvenile Court thousands of times over the past decade. A Rule 31 mediator, Daniel has been trusted to mediate hundreds of cases across Anderson County. A community leader, Daniel has worked closely with local officials to make Anderson County a better place. A conservative and dedicated husband and father, Daniel's faith has shaped his character and integrity. On March 5th, vote Daniel Forrester for Anderson County Chancellor.
We should never lose sight of our health. To keep moving forward, let's not forget everything we've learned. Limit the salty food options. Make your own daily exercise routine. And always receive regular checkups. More than anything, we have learned how important these small steps can make a big difference, so we can all continue to move forward together.
All right, crew, let's get started. Sure.
Don't ignore the law. You must call 811 at least 2 to 3 days before any digging project so you can avoid hitting our essential buried utilities. For digging projects big or small, make the call to 811.
From Oak Ridge, Tennessee, IB3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. IB3 Global Solutions. Mission first.
At Navarro, we partner with our clients to advance clean energy and deliver effective solutions for complex challenges in the nuclear and environmental fields.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
Okay, during the break, we had a wrestling match. The camera run won, Brad lost. But anyway, we're here and we're working on everything. We're going to talk about some new ideas, some new programs, and something where they're going to try to tackle a big problem. Big problem. I've seen grants, and it's tough. But I want you to listen to where we're going and what we're going to do. We're going to talk about free medical clinic starting to provide some mental health services. And I go to meetings tomorrow morning, Senator Haggers and others. I go to meetings all the time. We got to have more mental health facilities. Of course, nobody wants to pay for them, but we need more mental health facilities. And the problem is mental health is such a broad cup. They're lazy, they're bums, they did drugs. Then on the other half, you got truly neurotic, and I'm saying that's the perception. But in the end, there's plenty of room. There's tens of thousands in each category. So Billy deserves credit. The free medical clinic deserves credit. Now you got to get psychologists and psychiatrists on your volunteer staff. That's where you're headed. And we've had some good ones over the years here, but we'll see where it goes. So one of you tell me what we're going to do. What are we going to start? What are we going to do?
Well, the main objective of the free medical clinic, when we're looking at community health, we just talked to our community health leads, is to provide integrated care. You know, one of the things that has been a big challenge is we have a primary care division, but we don't have a mental health division. And a lot of our patients, especially in our population, have mental health needs that they don't have access to. There's barely enough facilities to provide mental health to those that have insurance, let alone those that don't have insurance. Then you add the dynamic of not just behavioral health, but then you talk about opioid issues and the epidemic that's going on with the opioids. And so that adds another dynamic to it, especially with our patient population. But talking about kind of transitioning a little bit, if that's okay, talking about primary care, mental health care, even dental care, optometry care. One of the things, even in the world of insurance, your dental care does not communicate with your primary care provider. So they're doing totally separate EMRs, which are electronic medical records. They have different databases, they have different charting, but yet dental has an impact on the health, as we found out through whether it be Alzheimer's, whether it be the stomach, the teeth, dealing with blood pressure, dealing with blood thinners. And so what we want to do is this, and this is our big objective. You're talking about taking on giant challenges. What would happen if the best clinic in the area was for the working poor?
Okay.
We have a tendency in our society to give the poor our leftovers.
Correct.
To give them, oh, we're not using this building, you can take it. But yeah, the reason no one's using it is,
dilapidated.
But what would happen if we said, you know what, we're going to make this a priority, and we are going to make sure the working poor have the best clinic in the area. For us, that means comprehensive care. Not just a facility and having money for resources, but it's making sure that they have dental, they have vision, they have primary care that includes specialty and preventative, and mental health. And what happens if those are all connected to where they can communicate to each other? That when a primary care visit happens and they realize, you know what, this person needs a health care assessment, go down the hallway because we have health care.
Yeah.
Or this person says, your issues are really in your teeth, we need to get your dental fixed.
Who does those assessments?
Who does which assessments?
The assessments.
The beginning assessment?
Yeah.
Well, right now, our volunteer providers and our paid staff does the original primary care assessments.
They've got a template to go with.
Yeah, and right now we have an incredible network, and we want to thank our partners, Covenant Health, Ridgeview for mental health. We have, what's some other partners that are key to our referral network systems?
Well, we've got a lot of state partners with the hepatitis C program, with the women's health program. They're all our partners, and we coordinate with all of them so that we can provide all of these services, all of the programs.
So it's a very complex network when you're trying to look at helping the working poor. But the component right now is the mental health, which we're just now talking. So it reaches now to that. What happens when we launch a mental health division? And right now that's going to take quite a bit of money to be able to do. And there's some funding out there for it. But the need is overwhelming.
Oh.
Overwhelming. When you're dealing with substance abuse, when you're dealing with medicated assistant treatment for opioids, it is a complex system. And so to us...
Let me touch a story real quick.
Sure.
Criminal justice. We went through this phase in the late 90s and early 20s where we were building in-house programs, out-of-house programs, in-jail programs, and everything else. But the problem was you can get clean, you can get all the help you need, but then you go right back into the collateral issues with your family, your friends, and you're right back where you were. It almost is a reconstructive need of getting their life to go in a different direction, or you got to treat the mental health causes, right? I mean, whatever they are and wherever they are, mental health people, especially I think in women's issues, where we found that may be that I'm totally off 20 years later, but are more dependent on different things in the community, relationships, and domestic violence being our main study, right? Mm-hmm. But you've got to move them out, and that costs money too.
Right, and that's why the mental health division solution has got to have the component of a navigational nurse and a navigational case manager. And what I mean by this, you're going to have the mental health practitioner, you're going to have the medical portions that have been trained in mental health, but just what you said is so true, because the people who are coming for those mental health needs are likely to be homeless, they're likely to have food issues, job issues, maybe they've just came out of the jail system, and it's going to take all of us. What I love about the Free Medical Clinic and our partners is we come to the table with so many other leaders, community leaders. Wade Cresswell's leading Roane County, we have Anderson County leading with the opioid committees, Morgan County, and they're getting everybody at the table and saying, okay, how are we going to solve this problem, because it's going to take all of us. So if someone comes into our Free Medical Clinic mental health division, then we've got to have a bridge from primary care, because if they have a mental health need, they're probably going to have a primary care need. They're going to have wound care needs. They're going to have all of these needs, but they're also going to need a place, and that's where the caseworker comes in to say, how can we connect you to education, to job, to shelter, to food, to clothing, because it's going to impact all of those areas. And we only have one component when we come to the table. It's going to take all of us to create a better future for our communities. But guys, if we don't do it, who's going to do it? I mean, these are our communities. These are our families that are hurting. So it's up to us. You know, one of the things I love about Roane County, Anderson County, Morgan County is we're the type of people that roll up our sleeves and we help our own and we help our neighbors. And that's what we've seen through our donors, who are incredible, generous donors, through our volunteers, through our partners. You know, these are people that are coming and saying, we want to create a better future, but it's going to take all of us. It's going to take the United Way with Naomi. She's fantastic.
Yeah,
you know, it's going to take Torch with Sheila Michaels. She's wonderful. It's going to take even the Children's Museum with Beth. Christine at the Chambers. It's going to take all of us to come together. It's going to take the police departments, the fire departments, the government officials, these elected officials that are going in right now with elections. It's going to take all of us to say, let's do our part and make our community better.
Kate, what do you want to add to that?
Wow, that's hard to add to.
Yeah, he rolls, doesn't he?
Yeah. He's got a passion.
Yeah.
The one thing that has hit me the most is people come to us. It could be a partner, it could be a donor. And when we get to their story, often in their story is that they have a loved one, they have a neighbor, they have a family member who does not have the care that they need. They don't have insurance. And this partner might be well-to-do or connected to our communities, but someone in their family, someone in their network has a need for us. And that's what always is so impactful for me. That I might come across someone and they say, we want to donate, we want to donate on a routine basis. And then after a little while, when they really hear our story and find out what we do, they say, hey, my daughter is 28. She went off our insurance. She's working part-time. She's having a hard time here. She needs insurance. Does she qualify? Yes. As we go through the steps, does she qualify? Yes. So bring her in, and we start providing the best of care.
And with, for example, Roane State Community College, TCAT, they have students and even faculty that use our services. We help probably over 100 on average per month. The college-age students, and those are going back to the workforce, getting training into those incredible partners that we have. Chris Ayers at TCAT is incredible. Angela Richardson there, also with Dr. Chris Whaley, which we already mentioned with Roane State. Since he's from Cofield, I got to give him two plugs.
Anytime, two at least, two
exactly.
at least.
Yeah, but those are incredible because that's the groups that we're helping. Let me do a follow-up story since we have a little bit of time.
Sure.
Junior brought this to our attention, who you just interviewed about the Hispanic population. In Roane County, they were getting together a van of Hispanics to be able to get medical care once a month. So they couldn't get it when they needed. They had to go once a month. They were paying $100 per person to get care and be taken to another county, and then they were paying in cash for that care, when right across the street we were there to make sure that they got no charge care. People are taking advantage of the same population that we're helping.
Let me ask you a question. I've done probably, of course, y'all know I'm in the political business, but I've probably done a couple 100,000 mailers this year. Why not take an 8 by 10 or a 6.5 by 11 and mail it to everybody with the picture on the front?
That's a good point. We've looked. There's some benefits of direct mailing, and I know that's what you're talking about. That's a lot of direct mailing. It does cost a lot, and we don't have a good rate of return of investment. We don't think for direct mailing.
But you're doing it for fundraising. I want to do it, and it is about 3% or so.
Yeah.
But I want to do it for. You got problems?
Awareness.
Come by.
We get a greater bang for our buck by piggybacking with our partners. If we go into Roane State and we partner with Roane State, for an example, or TCAT or Covenant,
I think you got
it may be, and we tell them, look, get this out on your social media, get this out on your on and offline marketing and your communications, because they already have those contacts, then they send them out. That's a challenge. I know that you face that as a politician and what you do in the community to get the word out in the community.
Name than that. What can I use?
Well, what is it? A community hero.
Yeah, anything you want to call it.
But it's a challenge in our 3 counties to get the word out, to communicate. So I want to challenge everybody that's listening right now. If you're out there and you need our services, we don't know who you are. You're going to have to make the first step. Go to our website, fmcr.org.
It's right there.
But here's the biggest thing. You ready? You have a social media account. Put our website on your social media account.
Exactly right.
And if we can get people to do that and take action on their social media, Facebook, Instagram, Snapchat, whatever it is.
Yeah.
Simply put our website or follow us on Facebook and let people know, hey, there's a place that you can go to get care. And there's a lot of people that lose their jobs and they get that gap and they don't have coverage.
I hear that a lot, though, where you'll say, well, I don't feel good. Well, go down the free, I'll tell people, other people, I hear it all the time, go down the free medical clinic. You know, I don't think people do. They used to be the health department. Now I hear your office more. So
well, we're honored. We're honored to serve that.
I think people are aware. I think they're getting more and more aware. I think they are. So we have what we kind of doing conceptual evaluations here, but what are you physically going to do? If you get the grants and you get the money donated, you say, okay, we're ready to go, what are you going to do first?
Well, there's a 3-year plan that we want to implement on top of the mobile unit, community health, women's health, and that is, number one, expanding the capacity in our Oak Ridge area. Oak Ridge is really our heartbeat of care because it is economically for our 3 counties. People come here for the hospital or own medical, and so we want to focus in on looking at our Oak Ridge clinic. We are looking for a new location to relocate in Oak Ridge. We're not moving out of Oak Ridge, but we need a bigger capacity area to service area. The second one is dental care, dental and mental health. We want to launch a dental clinic that's no charge. There is nothing in our area for no charge for dental care, and dental is expensive for everybody, even if you have insurance. And that we're hoping this year that we launch our mental health division, and we're waiting on some grants. We hope we get positive results from that.
Yeah, and my sister was the head of the Tennessee Dental Association last year. She's a pediatric dentist in Middle Tennessee. Went to school with you. She was a senior when you were a sophomore, but she went out and did all that stuff. Her and Mary and all of that. They all went out and they do some of that. Mary's a vet, but Gene, they go and they do dental services, and they have once a month, once a week. Of course, the health department here does it once a month, but it's nowhere near what they need.
No, it's not. And even, the millions got added to through TennCare, through the shift to dental care, and people are traveling from Oak Ridge to Nashville if they're on TennCare for dental. I mean, they're traveling 2.5 to 3 hours just to get dental care one way. And so it is an issue with our population, and we have to make sure that we're addressing that. And then lastly is we love Morgan County. And Roan State Morgan County campus is a place that we want to partner in a stronger way, but we're looking at possibly launching a clinic in year 3 in Morgan County and looking at those. So on our slate, mental health, dental health, another clinic in Morgan County to make sure we serve our county as well.
Morgan County is an interesting place because, Cofield and Wartburg could be, Russia and Ukraine. But we joke in sports and everything, but all the communities have their own personality and do really well. I have a lot of respect. Then you got to go all the way up north to Deer Lodge, and that takes the camper about a day,
right?
And all of that stuff. We're more of a contained environment.
Everybody can help. Everybody
now sing the Pine Valley Fight song for us. Okay, if you got the words, we can do it.
Everybody can help and do their part, whether it's getting the word out and posting our website, fmcor.org, on their social media, whether it's telling your family or friends if they need care, we're there. Whether it's a partner in the community that's not our partner yet, that we can serve together and make an impact. If you're volunteering or donating, man, you're not going to find a better organization to give to and help.
Absolutely. I'm going to do. Hey, how much you got? How much time? 2 minutes? Okay. Give me the outline of fundraising events. You have August,
right?
Which is your big bash.
The bash, right?
Anything else between there and now?
Actually, yes. We're June the 7th. Is that right? 7th. Okay. We're going to be at Opal Oak Summit. In Oakdale.
Is that like a resort or something?
No, it's a venue for the type of things that we're going to have
weddings
a bash.
and
I think it just serves the Oakdale community, a small place up there.
It's beautiful.
It's beautiful.
Everything up there on top of the mountains.
But it's the Roan County Bash. Last year we raised enough funds to buy 2 SUVs for our medical team that you just interviewed. And then August, the second Saturday in August is always the bash for Anderson County in Oak Ridge, the big one. And we have a golf tournament
the dance
Saturday.
Contest was rigged last year.
Yeah, dancing for
Tell
charity.
I go by and see my buddy down there at Oak Ridge Pharmacy, I'll say, rigged. Go ahead.
But we appreciate this. Thank you so much.
So June 7th, second week of August, that's the
second
2 big
Saturday
ones.
of August,
So
the
we've
big
got
bash,
3 or 4. That's in Oakdale, though. That'll be up there.
That'll be in Oakdale
That's
for
a
Roan County.
fundraiser, right?
That's correct.
Yep, and then the
We'll
other
come up
one's
there
in
next.
Oak Ridge.
Good.
Then we've got the golf tournament
The next
in
Saturday,
Oak Ridge.
right? And then, of course, we want to invite everybody to our ball drop, New Year's Eve countdown that we're
missed
doing.
it this year.
Yeah, you got to be there.
I ain't even seen the video.
Yeah.
Brad won't share it.
But we want to push BBB Communications. They're a big partner of ours. We love Brad Jones and what he does for our
Is he
community.
incredible?
Great guy. Great.
He's an incredible guy. Okay, we got 10 seconds or so. I want to thank you guys. Kate, always good to see you. Billy,
You too.
You do a fantastic job.
You as well.
Guys, thanks. I appreciate y'all.
Thank you.
All right. I'm
FMCOR.org,
still here, guys.
go for it.
Good. All right, we're out.